we had an objective to boost the management capacities of health providers on the ground. They are trained clinically, but they're not trained in management. So every 6 months we would train a batch of them per district, about 10 per district. In total, we trained 90 across the 3 districts. So Edith was among those people who were trained. And what she did is she took up the skills and implemented them. So she exercised the knowledge she had learnt to improve the system. She just didn't get away with a certificate. She actually implemented what she learned. So in that way, she helped with the implementation of the health systems component of Manifest. The things she did were successful because she was not afraid to fail. She was not the expert at managing, but she had learned a few skills and she was willing to put them to test. She was willing to make small changes at a time in order to see improvements.
I am part of the team that goes for supervision in other health facilities. Before, you could just reach a facility. It was like, this money is there for support supervision. So you go, you've not even planned the support supervision. And it's like when you go, you are going to inspect. And to police people around. Why aren't you doing this? Why aren't you doing this? But after that course, I was able to know that actually I appreciated the function of support supervision. I appreciated that before I leave a unit, these people should feel actually supported.
In order to improve the night duty and weekend duty for nurses, she exercised the human resource practice of joint decision making. So she called the nurses, she asked them for their opinions on how to organize a good night duty roster. And initially they were not excited about it, but eventually they realized that the workload is better managed.
I have been with Sister Edith for 6 months. When it comes to drugs that are supposed to be dispensed to the patients, she makes sure they are available. She makes sure she always orders for the drugs right from the pharmacy, and she has come down to always teach us on how to fill the stock cards and dispense these drugs as well in case she's not there.
Edith didn't only stop in her district, or she didn't only stop in her department. She exercised her skills in her department. She spread them across the hospital because they got to learn how to manage finances, how to manage drugs using stock card management, how to manage human resource using scheduling and also discussing performance among peers. But Edith also shared her learning in other districts. So what we did was to promote this shared learning, to inspire other health workers to see how they can use the management training. So Edith was taken to 2 additional districts where we had the health system symposia for health workers, and she shared her simple lessons on how to implement management learning at a practical level. And she shared how she had revolutionized the management of finances in a department, provided incentives like tea and other small allowances for staff using the resources they could generate internally. She also shared her experiences on how you can manage staff and make them actually enjoy working night duty even when it's a challenge, using simple participatory decision-making approaches. So in so doing, she inspired others to look for ways to exercise the skills they had learnt across this training, because they realized that they don't have to make decisions at a higher level, but they can actually make decisions at the level they are at and create change.